So, hello, my name is Dr. Sherita Golden. I'm a professor of endocrinology, diabetes, and metabolism at the Johns Hopkins University School of Medicine. And I am also the outgoing chair of the ASCI Physician Scientist Engagement Committee. And our committee helps to select candidates for the Lewis Sullivan Award. And I am delighted to interview our 2025 recipient, Dr. Consuelo Wilkins, who is a professor at Vanderbilt University School of Medicine, and so I'm delighted to have you here, and
Thank you so much.
wanted to ask you what motivated you to focus your research on health disparities and engaging underrepresented groups in clinical research.
Well, I grew up in a small town in Mississippi, and I witnessed those disparities and inequities in health outcomes very early.
Hmm.
And it was part of what motivated me to be a physician. So I saw people that I loved sort of suffer from poor health. We didn't have great access to health care, small hospital that eventually closed. And it really, led me to see how much care was needed in some communities. And so I decided to go into medicine early on, but it wasn't until a residency when I was at Duke and really seeing how the evidence that had been generated wasn't really applicable to everyone. So that sort of pushed me more in this direction of science and thinking through, what evidence needs to be created and how we need to make sure that all the populations that we care about, especially those experiencing disparities and inequities, are included in clinical research.
All right, great, great. So, what factors do you feel are most critical in your research success?
Oh, wow. So, obviously there's things like the training,
Hmm.
having good training, having amazing mentors, very important, understanding how to do good science,
Hmm.
rigorous science, the skills, the methods, all of those things were incredibly important. I think for me, the community was important. So,
Hmm.
community engagement, learning and understanding the differences amongst communities was really eye-opening for me. So
Hmm.
when I was early in my career, I was on the faculty at Washington University, and I had this great, one of the first studies I was doing, I was focused on Alzheimer's disease, cognitive impairment, and I wanted to look at some of the disparities. So Black, African American, Latinx people more likely to have Alzheimer's. And so
Hmm.
I'm going to look at this, I'm going to do the study, and I needed to engage more specifically Black men. We
Hmm.
did not have enough Black men in the study. So I'm going out in the community. I got connections. I'm going out and I get connected with retired police and firefighters in St. Louis.
Uh-huh.
And it's predominantly a Black group of Black men.
Hmm.
And I get there and I'm telling them about how great this project is and why they should be engaged. And they were like, interesting. Right. And they're like, no. And I was talking about mortality. I was using,
Uh-huh.
all the sophisticated language and data. And they basically said, well, we're all going to die. Like, we're not
Mm.
afraid. And, for this group of men, especially, like they're in
Right,
professions, they're not afraid of dying. So
right.
I'm telling them about death and they're like, well, what else you got? They want to know why should they participate? How is this going to actually improve their quality of life? Give
Hmm.
them more time with their families. And it should have been obvious that these are things that would
Right.
be important, but they really just made it clear that if I wasn't thinking about what they needed and how this
Hmm.
would impact their lives, what could be important to them, that they had no interest in it. And that really
Hmm.
changed my ideas and the way I approached science.
Yeah, no, and it's important that community engagement is so critical to
Right.
the success of
And
any
of course,
research.
we didn't learn about it in any of the training.
Right,
And it's not
right.
in my master's in science and clinical investigation
Hmm.
program, no community engagement,
Right,
period. Yeah.
right, right. Well,
Yeah.
fortunately, now there's a field of community-based participatory research that teaches those skills. But you're right.
Yes. Yeah.
When we both trained, that would not have been the case. So,
Right. Right. At least
mhm.
not for physicians. Yeah.
Not for
Yeah.
physicians. Right,
Yeah.
right, right. So, were there obstacles to getting where you are today?
Oh, how many? I mean, so many challenges. I think specifically from the science piece, early in my career, the idea of doing research in disparities and inequities was not as valued. It
Mm-hmm.
was presumed that, oh, it's good, it's important work, but it's not necessarily science. I was pushed really to do more mechanistic work
Mm-hmm.
and to think about some of the more cutting edge um, you know, technologies and radiology, especially around Alzheimer's and thinking about imaging.
Mm-hmm.
There, that I was pushed in that direction. I was told, you know, yeah, we love that you're interested in this, but that's not going to get you the publications and the high impact journals. It's not going to get you funded. And so I was really discouraged from pursuing this as a scientific career,
Mm-hmm.
but
Mm-hmm.
more of something I should just do on the side.
Right.
And I think that the whole idea that, this work was devalued
Mm-hmm.
um, created so many challenges, again, to the funding, to the kinds of support, to me, in some ways, having sort of parallel projects happening where, okay, I'm
Mm-hmm.
going to do this project that's looking at, neuroimaging because that's how I can get funding. But I'm going to do this work on the side
Mm-hmm.
because that's where I'm really interested. But of course, now we have, at least until recently, we had so many,
Mm-hmm.
more opportunities recently
Mm-hmm.
for funding in health disparities, health inequities, as
Mm-hmm.
well as community engagement.
Mm-hmm.
And certainly, I would say other barriers to to the work are understanding the methodology. So
Right.
again, a lot of that has been built in the last couple of decades, but really having training and access to resources to support
Mm-hmm.
the science.
Mm-hmm.
What those were certainly challenges early on,
Right.
and we could spend a lot of time talking about discrimination and racism and other things that
Mm-hmm.
I experienced. But I don't know that that's different from many other people
Right.
who are from marginalized groups in
Right.
terms of not normalizing it, but
Right. No, I
say
understand.
more unique to my specific area. Yeah.
Right. So
Yeah.
what you described earlier, though, was specific to the research area. That was
Yes.
the main challenge that you had to
Absolutely. Yeah.
overcome.
Yeah.
Right. Right. So where do you see the work going in the coming years? And I know you have a leadership role at Vanderbilt, sort of working in
Yes.
some of this space.
Yes. Um, I think we're at an important point to think about how we better communicate about our work and health disparities.
Hmm.
Certainly, in the last few months, we've seen health disparities, health inequities, the language be villainized and, in some ways, again, devalued in different ways.
Hmm.
And so I think this is where we need to actually double down on the support
Hmm.
for this kind of work and research. We continue to see disparities and inequities that impact everyone.
Hmm.
And so the idea that only those who are directly impacted, those communities, suffer is incorrect. I mean, we all suffer from having worse health, seeing some people have worse health outcomes. So I think that there are going to be even more challenges to doing the work,
Hmm.
having to describe it in terms that essentially whitewash it, take away the meaning, is going to make it more challenging to communicate. But we still have many opportunities to focus on the needs of the population, the
Hmm.
disparities, the inequities. This is where we really have to, as scientists, lean into the data.
Hmm.
I
Hmm.
think we are not doing enough pushing back with the evidence that we have that these are not ideologies.
Right. 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 Right.
These are
Yes.
facts that
Hmm.
that outcomes are worse.
Hmm.
And it's poor science. If obviously you study diabetes,
Yes.
if you're doing a study of diabetes and you don't have the people who are most impacted by
Right.
diabetes
Hmm.
in the study, it is not good science.
Right.
And for so
Right.
long, we have allowed this kind of research to happen where we've not actually included people, the full range of people who have conditions. And I think we need to start rejecting that. I think we need to stand up more in all areas, in the academy and in our respective institutions and publishing, in the advocacy organizations. I think this is where we need to really lean into what do we need to maintain the infrastructure and support and really advance this work and more effectively communicate about it.
Right. No, because effective communication is important because the disparities that impact health, aren't just limited to racial demographic groups, but multiple demographic groups, geography, rurality,
Absolutely.
disability. So that's a
Absolutely.
really
Yeah.
important point.
Yeah. And I
Yes.
mentioned, I grew up in a small town,
Mhm.
and I didn't consider it to be rural. That was all I knew at the
Right.
time. And when I was growing up, my town had 2 stoplights, so that was we were big. But
Right.
there are lots of small communities around it, and
Mhm.
I was recently awarded an endowed chair, and
Mhm.
it's focused on rural health. So
Mhm.
the
Mhm.
Mildred Thornton Stahlman chair in rural health, and so
Mhm.
I'm looking forward to using that as an opportunity to show how these inequities and disparities
Mhm.
are apparent across many communities, but also how over time we've actually um, continued to silo and marginalize
Mhm.
people by not recognizing the similarities in some of
Yes.
these
Yes.
disparities. The social and structural drivers,
Mhm.
they may be slightly different, but a lot of them
Mhm.
are common.
Right,
Yeah.
right. Well, and congratulations on that.
Thank you.
That
Thank
yes,
you.
that's
Yeah. Yeah.
wonderful. So, what lessons have you learned in your own training, and what advice do you have for trainees currently, or young physician scientists out there?
Oh, yes. Well, first, I would say that I'm so inspired by the young, early career physician scientists. They are really amazing, and I think they are thinking more broadly about work and how to do it, and how to think about the populations that are impacted. And so that certainly gives me joy that they
Mhm.
are willing to stand up and ask the right questions.
Mhm.
Um,
Mhm.
in addition to realizing that you need to understand the communities that are impacted, and um, have have demonstrate trustworthiness
Mhm.
and be
Mhm.
able to actually connect with them. I think that's really important in terms of the skill sets you need to be a good physician scientist, and effectively communicating with people, the cultural humility that you
Mhm.
need to do that. I think those are things that, um, when we were writing our med school applications, we're saying these things that we
Mhm.
want to help everybody, we want to communicate, we want to save the
Right.
world. And then I think in some ways in medical school and in training, we try to strip all those things out of them, like
Mhm.
just be the expert and don't care about people as much in different ways.
Mhm.
I'm sure it's not consciously that we're doing that, but I think a lot of that happens, and we need to ensure that they maintain that and they actually strengthen that. So I think learning how to engage communities is
Mhm.
important.
Mhm.
If you're involved in health disparities, health inequities, um, you need to understand the social, again, structural factors. And a lot of times that means you need to partner with a social scientist if you're not a social scientist.
Yes. Mhm.
And
Mhm.
we tend to bring those people in at the end when we've already developed the protocols and written the grants, and then we
Mhm.
just want them to kind of make it better or recruit people for us. And
Mhm.
we are really missing a key piece of that, is that you need a social um, or structural determinants of health conceptual framework
Mhm.
to really lead that work. And then I would say again, back to the communication. If you cannot effectively communicate about your research and why it's important. Doesn't matter if it's at the cellular level, if it's, basic science research, of wherever you are in the spectrum, you need to be able to clearly communicate. And I think we're seeing that missing right now,
Yes.
as people are confused about what we're doing and conflating terms. And this is an important opportunity to learn and make sure we know how to tell the stories
Right. Yes.
behind the work.
Yes.
And then I think the last thing I would say for young physician scientists is to be bold and curious with your questions, and don't be afraid to sort of ask us, why we didn't do something or why we did something one way. The questions, the way that the students have pushed us in thinking about things like race-based algorithms and things that we have sort of accepted and need to de-implement. I think we need more of that, and we should be encouraging them to do that.
Well, thank you. This has really been a delight
Thank
to
you.
interview you, and thank you for your time.
My pleasure.